Hello everyone. Today we'll be talking about Lyme disease, a bacterial infection transmitted through tick bites. We'll cover its causes, symptoms, diagnosis, treatment, and prognosis. So in talking about the etiology of Lyme disease, it is caused by the Borrelia burgdorferi, a spirochete bacterium transmitted through the bite of an Ixodes tick, or known as a deer tick. So these ticks become infected after feeding on small animals like white-footed mice and can then spread the bacteria to humans. Now we're going to move on to some of the descriptions and characteristics of Lyme disease. So it is the most common tick-borne illness in the U.S. It affects multiple systems, including the skin, joints, nervous system, and heart. And without treatment, it can lead to chronic symptoms such as arthritis and even neurological problems. So now we're going to talk a little bit about the course of the disease. The disease progresses in 3 stages if it's left untreated. In the early localized stage, which occurs within days to weeks of a tick bite, symptoms include a red expanding rash known as erythema migrans, which there's a picture of that in the right corner, as you can see. Sometimes it's called the bullseye rash, along with fever, chills, headaches, and muscle aches. The early disseminated stage can develop weeks to months after infection, causing multiple rashes, joint pain, facial paralysis, meningitis, and heart problems. And then the late disseminated stage occurs months to years later and can lead to chronic arthritis and neurological complications. The anatomy involved in the Lyme disease process affects several key systems in the body. So the skin is the initial infection site, often presenting with the red rash we mentioned in the last slide. Joints, particularly the knees, can become inflamed, leading to Lyme arthritis. The nervous system may be affected, including facial nerve palsy, neuropathy, and cognitive impairment. And finally, Lyme carditis can disrupt the heart's normal rhythm. So in talking about effects of Lyme disease on normal structure and function of the body, again, Lyme disease can significantly impact various systems. The musculoskeletal system causes joint inflammation, chronic pain, reduced mobility. In the nervous system, it may lead to meningitis, nerve damage, cognitive difficulties, and like we talked about a little bit before, the cardiovascular system can also be affected, resulting in irregular heartbeats. And then persistent immune activation can trigger long-term symptoms. So in talking about incident rates and statistics for Lyme disease, each year about 476,000 cases of Lyme disease are diagnosed in the U.S., which makes it the most common tick-borne illness. Most cases do occur in the Northeast, Upper Midwest, and Mid-Atlantic regions, and there is a little map actually behind our text, and you'll see all of the dots where most of the cases are reported. And then children aged 5 to 15 are at greater risk just due to more outdoor activity, being in closer contact with grass and shrubs. Children are often closer to the ground and come in contact with those areas. They may also have less awareness of where the ticks are likely to be. They may have difficulty recognizing and removing ticks. They do have a weaker immune system, as you know, the immune systems are still developing. And then those that are ages 50 and older are also at higher risk due to, again, a weakened immune system. As we age, the immune system generally becomes less efficient. Longer exposure time. So people over 50 have spent more time outdoors, particularly in areas where ticks are common, giving them a higher cumulative risk of tick bites over the years. And then older adults may experience different or less typical symptoms of Lyme disease, so that can lead to a delayed diagnosis at times. And then lastly, chronic health conditions. So older adults are more likely to have underlying health conditions that may complicate the kind of symptoms and treatment of Lyme disease. So in diagnosing Lyme disease, the method of diagnosis is typically clinical. The presence of a characteristic bullseye rash or Erythema migrans in a high-risk area is often enough to make the diagnosis, and lab tests may not be necessary. The rash, along with symptoms such as fever, joint pain, neurological signs, and a history of tick exposure are key indicators that suggest Lyme disease. There's also serological testing, which are, just blood work. So if lab tests are needed, serological testing is commonly used. The first tier test is an enzyme immunoassay, EIA, or enzyme-linked immunosorbent assay, ELISA, which checks for the antibodies against Borrelia burgdorferi, the bacteria that causes Lyme disease. If this test is positive or borderline, a Western blot test is performed as the second tier test to confirm the presence of the antibodies. And then direct detection methods can also be used, although they are more limited. For instance, the polymerase chain reaction, or PCR, detects the DNA of the bacteria. However, PCR is less commonly used because the bacteria levels in blood samples are typically low, making detection challenging. Another method is culturing the bacteria in a lab, though this is rarely used due to the long incubation times required, sometimes even up to 12 weeks. So, and then lastly, a skin biopsy could be taken from the rash and can be used for bacterial culture or the PCR analysis, which provides another way to confirm the diagnosis. So there are quite a few emerging diagnostic technologies for Lyme disease. Multiplex serological assays are a newer advancement in Lyme disease diagnosis, and they allow for the detection of multiple tick-borne diseases simultaneously. This approach is becoming increasingly important as co-infections can be common in Lyme disease cases. And then research is also exploring new biomarkers that can improve detection accuracy. So one tool is the TBD serochip, which is a microarray-based test that differentiates antibody responses to 8 tick-borne pathogens. Another promising tool is the mChip-LD, a microfluidics-based assay that detects 3 Borrelia burgdorferi antigens specifically for Lyme disease diagnosis. And then finally, the XVFA is a paper-based lateral flow test that targets the 7 Borrelia antigens designed for rapid point-of-care testing. So all of those methods help improve diagnostic accuracy, reduce false positives, and better identify co-infections, which I mentioned can be common in Lyme disease cases. This is especially useful in ensuring that patients receive the appropriate treatment for all tick-borne illnesses they may have been exposed to. And then addition to serological tests, metabolomics and microbiome analysis are emerging as powerful tools for early Lyme disease detection. So it involves analyzing small molecules in blood, urine, or tissues to detect Lyme-specific changes using tools such as liquid chromatography, mass spectrometry. On the other hand, microbiome analysis looks at changes in gut bacteria caused by Lyme, using DNA sequencing to provide further diagnostic insights. For the treatment, medication for Lyme disease, the early stage Lyme disease is treated with oral antibiotics such as doxycycline or amoxicillin for 14 to 21 days. For late or disseminated stages, longer antibiotic treatments are required. Severe cases with neurological symptoms may need IV antibiotics like ceftriaxone. All right, so wrapping it up with the prognosis here. With early treatment, so within 4 weeks of the bite, most people fully recover with antibiotics. Delayed treatment is still effective, but up to 50% may still have some lingering joint pain or cognitive issues. And then about 10 to 20% of people may have long-term fatigue and pain with something called post-treatment Lyme disease syndrome. And then without treatment, in the early stage Flu-like symptoms and a red rash will appear. In the disseminated stage, which is months later, bacteria spreads to the joints, heart, nerves, causing paralysis or meningitis. And then in the late stage, which can be months to years after, that's when you develop the chronic arthritis, nerve damage, and severe complications like autoimmune disorders. Thank you, everyone, for your attention and your interest in Lyme disease.